Hi, Brooke. Good to see you here today. Thanks for joining us.
Hi, Karen. Thanks for having me.
Yeah, it's an absolute delight. I'm so excited to get into having a good old chat with you today about how leaky gut can make such a huge impact on fertility. So I think it's one of those things that goes unnoticed and just passes under the radar. Just to lay the foundation a little bit though, so that you know who we're talking to today, Brooke Kane is a functional medicine registered nurse and she specialises in IBS, but she specialises in it for women, which is hugely important for us because obviously women and men are not necessarily built the same. She is the founder of Rooted Home Healthcare, where she brings 13 years of nursing experience in emergency and critical care to provide in-home IV fusion services. But more importantly for us today, she also leads the IBS Solution, which is a private membership group focused on IBS relief on school, where she specialises in helping women. So you can see why she is the perfect person for us to be talking with today. A comprehensive approach to gut health makes her invaluable for understanding the connection between digestive health and fertility, all importantly. So, Brooke, my Fertility Bandwidth program focuses on improving fertility by bringing the body back to its perfect balance naturally. Because when the body works optimally, it has at that point the bandwidth to create a baby. And without this root cause approach that looks fundamentally at what's causing everything to be out of balance, it's really difficult for ladies, or many ladies, to conceive because their body is using the resources, working with all of this, and that means then that it can't get pregnant because it doesn't have the energy. It's using that energy on these issues. One of them being IBS, leaky gut in particular, as that's what we're talking about today. So when we're working with gut issues where the body feels like it's constantly being attacked, this can be a huge underlying issue for many of the ladies with infertility problems. So I wonder if, with a view to us addressing chronic inflammation and restoring the body's natural processes, if we could just have a look at your take on it and, you know, any interesting insights that you might have that, you know, the ladies might find interesting. And also it's just a little bit more interesting to hear from someone who actually specializes in this on a day-to-day basis because there's a lot of detail. So how does that sound?
Perfect.
Excellent.
Yeah.
So to start with, can we just, or can you just explain to us what leaky gut is? Because many of my ladies often feel like they're lost when it comes to their gut health because it's not discussed enough in fertility clinics especially. So could you explain what it actually is, how it develops, and also why it's so often overlooked in mainstream fertility discussions, if you've got any insight into that?
Yeah. So leaky gut or intestinal permeability happens when the lining of your intestines gets weaker or damaged, which starts allowing things that are not supposed to pass through the gut lining, like digested food, toxins, bad bacteria. They start passing through that lining and they leak into your bloodstream. So normally the gut lining works like a super tight wall with tiny little gaps that only let nutrients through while keeping the harmful stuff out. But if that wall gets damaged due to things like stress, poor diet, certain medications, illnesses, it can develop tiny little holes that actually let unwanted stuff through. So this can lead to inflammation and even cause symptoms like severe digestive issues, but also other things like mental health issues, hormonal imbalance, PCOS, infertility. So leaky gut is often overlooked in mainstream healthcare because traditional medicine tends to focus on treating individual body systems like the heart, lungs, or skin rather than,
rather than the whole body.
Yeah, rather than looking at how all these body systems are connected. So they might treat the symptoms in one area without realizing that they're actually linked to gut health. For example, they might treat infertility or things like PCOS or endometriosis by looking at hormone levels alone. without ever considering that these could stem from inflammation that's coming from the gut. So this is why it's important to take a whole body approach like you do, recognizing that the gut plays a huge role in all of these body systems.
And also as well, you said that it leaks into the blood. Well, the blood flows throughout the whole body. So it stands to reason that it's going to be the whole body that is at some level or other affected. Would that be fair?
Yeah, definitely fair.
Good. So in terms then of the link between leaky gut and fertility, in my program, we focus heavily on addressing inflammation. That's like a huge category. Inflammation can come from any number of different sources, and very often different sources within the same person as well. But essentially, that can be one of the big root causes of infertility. So obviously, leaky gut is a huge cause of inflammation. Can you walk us through how it can lead to systemic inflammation and ultimately then impact infertility or fertility? And I guess, for me, that is the same between natural conception and IVF.
Mm-hmm. Yeah. So we know now that leaky gut allows harmful substances like toxins, bacteria, undigested food to escape from the gut into the bloodstream. But when this happens, the immune system detects those things as a threat, and it launches an inflammatory response to protect the body. So over time, this ongoing immune activation leads to chronic systemic inflammation, which disrupts the proper functioning of other systems in the body. And, leads to the digestive issues, food sensitivities, skin problems, fatigue and brain fog, things like that.
Yeah, that's really interesting. Because of course, like you say, it is that time. And obviously the inflammation, you said it sends out kind of like the cleanup crew to deal with the inflammation. That's what I'm talking about when I'm talking about fertility bandwidth, and how inflammation, leaky gut being one cause of it, creates more workload for your body to process, rather than then being able to use that energy for getting pregnant, because it's dealing with this inflammation, and like the cleanup crew are out there working overtime.
Yeah, definitely.
So in terms of the symptoms that my ladies could be looking for, or anyone really, I mean, it's not just my ladies, but, anyone could be looking for, obviously I work with ladies who experience anything from digestive discomfort, autoimmune conditions, very often several of them, alongside the fertility struggles that they're dealing with. What are the key signs of leaky gut that they should look out for, especially, I guess, the less obvious ones, that are connected to hormone health, cycle irregularities, and so on?
Yeah, great question. So the key signs and symptoms are digestive issues like bloating, gas, diarrhea, constipation, food sensitivities or sudden reactions to foods that you previously tolerated just fine. Skin problems is a really big one that a lot of people don't realize is actually related to gut health. So things like acne, eczema, rashes, oftentimes those are stemming from leaky gut. It's not actually a skin issue at all.
And that's because this toxin needs to get out of your body somehow. So it uses the easiest route.
Right, exactly. Yeah. So fatigue, brain fog, mood changes, of course, hormonal imbalances, and then chronic inflammation symptoms like joint pain or headaches. That's another one that is often not associated with leaky gut.
Yeah, and the reason that I guess it's not associated is because we don't necessarily make the connection between the inflammation that causes the aching joints, for instance, in the autoimmune, like rheumatoid arthritis or something.
Exactly.
Yeah, but it doesn't mean that it's not causing it. It's just that traditional medicine, generally speaking, is looking at more of a focused approach to one particular area, so they're missing the other connections.
Right. Yeah. And oftentimes they'll address inflammation, with steroids or whatever, but still not looking at where's the inflammation coming from. If we don't get rid of the root cause, then we're just going to have to continue attacking the inflammation. And it's not really ever going to go away if that root cause is still in there. And oftentimes it is leaky gut.
And you're working with the root cause as well in your clinics. Yeah. So important. Because how can you move forward if this thing that's causing the problems is still there? It's just like sticking a Band-Aid on.
Right, exactly.
In terms of hormone balance, because you mentioned that leaky gut can lead to hormone imbalance as opposed to hormone balance, one of the most common concerns that I hear from ladies, generally speaking, I mean, there's lots of them, but, one being short cycles, poor egg quality is huge. And I know you talked about brain fog, but we haven't quite looked at the detail of that yet, and difficulty with implantation. So how does the gut influence hormone balance, specifically, I guess, estrogen and progesterone, but not necessarily limited to? And how does healing the gut then help to support these areas of fertility?
Yeah, great question. Important question. So it plays a huge role in hormonal balance, especially with estrogen and progesterone. One of the key ways is through a collection of gut bacteria that actually helps metabolize and regulate estrogen. So if the gut's imbalanced due to leaky gut or an imbalance in the bacteria, estrogen can actually build up or be recycled back into the body instead of being eliminated, which leads to imbalance. So chronic inflammation.
That's how you see like the inflammations with endometriosis and inflammation, and it's all cycling back into itself. Interrupt.
It's fascinating. It's fascinating. So the chronic inflammation from the gut issues can also disrupt the communication between the brain and the ovaries, which affects progesterone production and ovulation, which are obviously critical for egg quality and implantation.
Yeah, it is. It's so interesting when you start getting into the specifics of how everything links together. There's no end to it, is there? There's never an end to it. It's fascinating.
Yeah.
Now, in terms of egg quality specifically, in my work, I explain to clients that nutrient absorption is critical for egg quality and cycle regulation. It sounds like leaky gut, but tell me if I'm wrong, but the way that I understand it, can leaky gut cause deficiencies in nutrients. So things like zinc, magnesium, B vitamins that we need for fertility and for a successful pregnancy as well. So how do you recommend addressing that?
Yeah, so it definitely has a huge impact on nutrient deficiencies. So when the gut lining is damaged, it struggles to actually absorb these nutrients properly, even if your diet is rich in these essentials. So chronic inflammation and dysbiosis or imbalance in bacteria can impair nutrient absorption and increase the body's demand for some of those nutrients, which makes deficiencies more likely. So one of the first things we want to do to address this is heal the gut. So focusing on repairing the lining with a very nutrient-dense diet, gut healing foods like bone broth, some targeted supplements like L-glutamine or collagen. We want to replenish nutrients by including foods that are really rich in things like zinc, magnesium, and B vitamins. If needed, we need to use some high-quality supplements to boost those things. But improving digestion is a really big one when we're talking about repairing gut health and taking care of nutrient deficiencies. If we're not digesting optimally, we're not absorbing nutrients. And then, of course, reducing inflammation, like we've been talking about, is huge.
Yeah, and then earlier on you mentioned this, and then you alluded to it a little bit then as well. So we talked about the gut lining and how it essentially becomes a little bit perforated, more like a colander than a sieve type setup. So if things are escaping into the bloodstream and it's traveling around. Now, would it be fair to say that that effect then could be linked to why you have brain fog very often, because it's the same issues that are happening in the brain, for instance, as an example. But then also when we're talking about the quality of an egg, the membrane of the egg obviously needs to be as robust as it possibly can be. Is that a fair link?
Oh, definitely. Yeah, yeah. So when the gut lining's compromised, inflammatory signals are circulating throughout the body, as you mentioned, up to the brain, everywhere, which ends up disrupting hormonal balance and affecting the uterine environment. So that persistent inflammation can exacerbate things like endometriosis and more, where inflammation and excess estrogen are playing key roles.
Mhm.
And they make the uterus less receptive to an embryo, which reduces the implantation success.
Yeah, because if you think that something's really inflamed, it's not. It's a hostile environment, isn't it?
Yeah. Yeah.
Um,
Yeah.
Just sort of taking that one step further, we know that inflammation plays a big role in conditions like endometriosis and this implantation failure. So is there any kind of specific conditions? I mean, obviously we've talked about that and briefly mentioned PCOS, that are kind of like a red flag for leaky gut. If people are like, I don't know if I've got leaky gut or if that's linked to my endo, is there, a connection that they can look out for?
Yeah. So again, probably some of those telltale signs like the skin issues, achy joints and things like that, brain fog, some of those same symptoms would alert them that there's a connection here to their gut.
Yeah. And then it was quite interesting what you were saying earlier as well about the gut microbiome imbalances and how that contributes to fertility challenges. What steps, other than obviously the bone broths and things, but can women do to improve theirs? Is there anything like exercise or movement or other ways that this can be improved other than just what you're putting in when your body's not necessarily absorbing the nutrients properly anyway?
Right. Yeah, definitely. So, I mean, what we're putting in is important, but, including things like fermented foods is really important. And that's one thing as far as the putting in piece that a lot of people miss. Avoiding triggers, supplementing wisely. But as far as non-food pieces, managing stress is a really big one. Chronic stress can actually alter the gut microbiome, the balance between the good and bad bacteria. So incorporating relaxation techniques is really important. Staying hydrated, as that supports digestion and helps maintain a healthy gut lining as well.
It's really interesting because there's 3 types of stress, isn't there? And obviously your gut is one of the big stresses on the body. So it's not, when we talk about stress, we tend to think about emotional stress, but there's 3 types. So definitely not just the emotions that we go through that create havoc with our body on a daily basis.
Mm-hmm. Yeah.
Okay, so have you got any, and I don't know if you do or not, so, but many of my clients, they feel like they've tried everything. But the problem is they're hearing and then trying everything. Like just a few days ago, I was talking to someone, she was taking apple cider vinegar. Now, for some people, that can be like a huge game changer. But when we looked at her root cause assessment, it was totally clear that this was actually causing a big part of her particular fertility challenges. So I guess this is where it becomes so complex, because fertility is as unique as your fingerprint. But there's so much generic advice out there that people don't know what to do, and then they end up either doing nothing or doing everything, which is not necessarily going to help them. So is there anything, do you have any insight, any success stories where healing the gut had a dramatic impact on someone's fertility journey, with things that could probably apply to anyone? It's just a good practice.
Yeah, so that's a really common frustration. People feeling like they've tried everything, or feeling like there's so much information out there. Which one do I listen to? So usually addressing inflammation through diet is one thing that a lot of people haven't tried. I did have a client a few months back who was experiencing really irregular cycles along with a list of digestive issues. So ultimately she came to me for digestive issues. But after working together on those issues and decreasing the inflammation for 12 weeks, her digestive issues were gone, but her cycles started to regulate again for the first time in many years. So obviously regular cycles are very important for fertility. But I do see this in a lot of my clients who come to me for gut health, but naturally with that gut healing, other body systems are starting to kind of regulate. Their aches and pains are going away as well. Fascinating.
Yeah, it is. It's absolutely fascinating. There's no way when you start working with the whole body that you're not going to impact something else as well for the better, even if they come to you or they come to me or they go to someone else who has a similar full body root cause perspective on healing whatever problem it is. There's always going to be a huge benefit somewhere else along the line as well, isn't there?
Yeah, yeah.
That's great. I have run through my list of questions. Is there any one little bit of tidbit advice that you think you could give? You know, if people just pick one thing up from today, that would be really useful.
Yeah, that is to not downplay the effect of gut health on the rest of your body systems, especially hormones. So following a basic food framework is what I like to tell people in regards to not feeling kind of stressed out about where do I start, what do I do? Focus first on just eating whole foods and not processed foods, getting enough protein.
Why the whole foods, not processed?
Yeah, those processed foods are full of chemicals. They're highly inflammatory. So people dealing with hormone imbalance or infertility issues, you got to cut that inflammation piece out. Don't add additional inflammation in there.
Yeah.
Yeah.
So important. Yeah. Thank you for that.
Yeah.
I cut you off there. Sorry, in full stride. Are you?
No, you're good. So protein's really important, especially animal proteins, because they're full of amino acids and essential nutrients like the zinc that we talked about earlier, magnesium, things like that. So just a basic framework of making sure you're getting lots of animal protein, fruits to support a healthy microbiome, and definitely cut out those inflammatory processed foods. That's a really good basic framework to start with.
And almost then like you're avoiding the issues from even starting in some respects,
Right.
if you do that. Yeah. Great advice. Thank you.
Yeah.
Well, it's been lovely speaking with you. If anyone's got any questions, then you can post your questions below. That's absolutely fine. Both Brooke and I will be around and about within the context of this to answer any questions that you might have. And you can find Brooke on the IBS Solution on Instagram if you want to give her a quick follow. So thank you, Brooke. Thank you very much for today.
Thank you for having me, Karen.
Yeah, it's been a joy. See you next time.
All right.